Dr. Art Mollen is here. He's ready to do some house calls here.
Perfect.
On Good Morning
Okay,
Arizona.
great.
So we're answering your questions, and the first one is coming from Danielle. Good morning, Danielle from Glendale. She says, Dr. Art, I'm 42. Just started taking Zoloft for anxiety, depression. I'm taking the medication in the morning. I kind of feel tired, fatigued, also increased acid in my stomach. So how can I avoid these side effects?
Well, the first thing is I'd switch the medication. Don't take it in the morning, start taking it at night. The scientific literature isn't exactly clear on this. Some people take it in the morning and they do very well. Some people take it at night. So it depends upon your individual metabolism and how it's affecting you. So one of the things in the literature, it suggests that it does increase acid in your stomach. So a lot of these drugs, whether it's Zoloft or Prozac or Lexapro, they can increase stomach acid. So there's no rhyme or reason whether you take it with a meal or after a meal or before. So it just depends upon how you're reacting to it. So I'd switch it up and start taking it, say, at night instead of in the morning.
Okay.
That may reduce the fatigue.
Obviously very in touch with her body that she noticed what changes were happening.
Yeah, sure.
That's good. And then Heidi wrote in as well. She said, several hours after Thanksgiving dinner, I started vomiting, severe stomach pain, lasted for about 12 hours. She says she cooked the dinner, no one else got sick. So did she have food poisoning or maybe a virus?
Yeah, well, it sounds like cross-contamination, and I am a victim of cross-contamination several years ago when I was cooking the turkey, so I know exactly what happens. So sometimes the person who's actually at the cooking and trying to do their culinary event, what happens is they might take a fork and stick it into the turkey to see if the turkey's done. They take that same fork and they may test a vegetable. So that's what often happens if the turkey isn't entirely cooked. So it's usually the result of cross-contamination. Although you could have had a virus, it sounds like it was more of a food poisoning simply because of the timing and when it occurred.
Okay,
Yeah.
thank you. Well, thank goodness everyone else didn't get
Yeah,
sick,
yeah,
you know?
yeah.
And then Jenna wrote in too. Morning to you, Jenna. Jenna says, I'm 23, recently diagnosed with seizures. I'm taking Depakote. Do those drugs have any side effects if she's pregnant?
Yeah, well, exactly, because when people are taking those anti-seizure medications, I always underscore the importance of being on birth control pills. And that's what's in the scientific literature, because some of those drugs can potentially cause fetal abnormalities and fetal complications. So you have to be very, very careful. It's not to say that you will have a problem if you're pregnant with your fetus, but it is something to be cautious about. Take birth control pills if you're taking those medications.
Okay, let's roll through these really quick here. Vince from Scottsdale Road said, I'm going skiing next month, often experience altitude sickness. Can I prevent this from happening, and what altitude does he need to look out for?
The best prevention, of course, is increase the fluids. The first 48 hours that you get to a higher altitude, above 5,000 feet, you can experience this. Increase your fluids. Decrease the alcohol consumption, and you're going to have some fatigue over the first 48 hours. Just anticipate it, a gradual ascent until you acclimatize to that environment.
Okay, then Jeremy from Tempe says, I'm 35, have been having shoulder pain for about 3 months. My doctor thinks it's rotator cuff syndrome, but the MRI didn't show any significant damage. They've suggested decompression surgery. What do you think?
Well, I would hold off on the decompression surgery. What I like to do is physical therapy for at least that 3-month period. See if it starts to improve. You can do some exercises at home to increase the strength in your shoulders. A lot of people jump for surgery when they have shoulder pain, but the reality is often, unless it's been a traumatic tear, in that area, you can actually treat it with some physical therapy and more conservative means. So don't think that surgery is necessarily the cure-all, because sometimes after the surgery, it doesn't necessarily get better. So you have to be careful with that. I think surgery is indicated if there's a severe rotator cuff tear, but for the minor tears, often they will heal on their own, and it doesn't necessarily get worse if you're using your shoulder or anything like that. So be cautious.
Thank you, Dr. Art. Good to see you. And if you have health questions for Dr. Art, just email him directly at askdrartmullen@gmail.com.